Welcome to Reimagining Food in Healthcare. Today, we have Carolyn Wescott, founder of Plated Foodservice.
Imagine it like you're being asked to live on a 1990s budget today. And if you're thinking that's insane, like how is that? You're right to feel like that.
Sure.
Not off base, no.
How you doing today?
I'm good, how are you?
I'm all right. Now, Carolyn, I must ask, the title, Reimagining Food in Healthcare. What's the problem? Why are we doing that?
Yeah, so food service operations in the healthcare environment, it's not something most people think about day to day, right? If you're at the hospital, you're at a rehab facility, you're not there to get a meal, right? You're there to get health care. You're there to have something fixed. You're there because you can't care for yourself anymore for whatever reason. So food in these spaces is unfortunately sometimes an afterthought. And because of that, it's been a really sleepy part of the food service industry. I mean, food service industry at large, when you think about retail and grocery and hospitality like hotels and fine dining, all these other spaces we eat, right? They're highly innovative. They're constantly bringing new products to the market, new approaches, new service models. But this institutional, and I don't love the word institutional, but when we think about all the spaces people are eating where they're not really going there just to eat. They're going there for healthcare. They're going there for mental health care. They're going there for assisted living and what we call activities of daily living support. So they still have to eat. And so the food is very important, punctuates their day, but it's often not the first thing, not what gets the most attention in that community.
When we talk about these meals, what exactly are we looking at here? In terms of the food itself.
If you Google it,
okay,
you get some pretty gnarly pictures. There's
I've been
some
to a couple
subreddits.
Myself, yeah.
You can check out Reddit. There's some pretty good subreddits on this because when people get a bad meal, they want to talk about it.
Sure.
Anytime somebody has a bad experience, right?
Yeah.
It's natural to want to go and show the world and show your friends and family this is what's going on, right? So what does it really look like? It looks like often okay food, not very good food. It's like the traditional bad hospital meal. Yeah. And what's really awful about it is that most of us, we go to the hospital and we're there for a short amount of time and we can tolerate a few bad meals. But in skilled nursing centers and rehab centers, this is the person's home. So this is what they're eating every day of the week, potentially for the rest of their natural lives. And when you think about a subpar meal, once or twice, it's tolerable. But every day of the week, the individual takes a hit to their dignity and their happiness, which is really unfortunate.
These facilities are running on $40 per week per person. How do they even make that work?
Yep, it's pretty wild, and it most of the time doesn't work when the budget's that low. Something gets sacrificed. So $40 per person per week on raw food alone is less than the USDA's thrifty spending plan. So the USDA is telling per person in a family just living out in the community doing their thing needs to be spending I think the current metric is at least $60 a week on food. But in nursing homes, we're asking these communities to feed their residents on less than that, which, sure, there's some economy to scale there. So you get some savings because you're buying in pretty big bulk. It's like throwing a dinner party for 100 people every day of the week, 3 times a day. So it's a lot of food, and they get some benefit from the volume that they purchase, but not that much. And so the amount that's allocated in these communities for the food service program, what feeds residents breakfast, lunch, dinner, snacks, everything they need, is very low because they're operating on restricted budgets based on the way the nursing homes are paid for their services.
Sure.
So if they're at that very low budget mark, they're probably being paid by Medicare and Medicaid, so CMS, Center for Medicare and Medicaid Services. Those budgets, those reimbursement rates, haven't kept up with inflation. So we're asking them to continue to provide services based on a budget from decades ago. And just doesn't make sense. Something's got to give, right? So they're either going to cut labor, they're going to cut the food quality, they're going to not operate as well. So it's not pretty. So that more budget part of the market is where I've spent a lot of time in my career. I was working for a contract food service management firm. And what was really remarkable to me about this part of the market is the staff at these communities are just stressed to the max. They have all these headwinds that they're facing. They are struggling to find staff. As much as they want to be there, it's a tough environment to work in, and the burnout factor is very real. And then they're faced with tighter budgets because they need to do more and care for more people. We've got probably I think the last time I saw the stat, it was like a threefold increase in the number of people who are going to be using assisted living and skilled nursing services over the next 30 years. And then the expectations, the level of care, the expectation from the individual coming in and the family that are visiting the residents continues to increase, which is not a bad thing, right? But it's more and more challenging to meet those expectations when you've got fewer staff and a tighter budget.
When most people think about problems in the healthcare facility, they probably think about medical stuff and medicine itself, not food. But why exactly food and food service? Are they important to you?
Yeah, it's so easy to forget about the human element of food in these spaces, because usually when people are in the hospital or they're in a rehab center or they're in the part of life where they need additional care, so they need skilled nursing care, they're at those places not for the food. They don't go for the food experience, right? So it's really easy to forget that, oh, this person needs to eat when they're here, but they need to eat 3 times a day. And that amplifies over time, right? Like, how often are you coming into contact with other services in that facility? So you think about physical therapy. You're maybe seeing them 3 times a week, maybe every day if you're in a high intensity rehab, but you're eating 3 times a day. So food service is this prime opportunity to make or break the individual's experience, whether it's healing, keeping them comfortable, calming them down. You have 3 opportunities a day to define how their day is going. And I often say food punctuates the day in these spaces, because you have an opportunity if you had a rough PT session or you got news that wasn't great or your family left and you're feeling sad and lonely, you've got another meal coming around the corner that maybe can brighten your day. Not only do you have the meal there, but you've got the person that's going to deliver it to you. So then you've got a human interaction moment that happens 3 times a day. So you've got all these opportunities to make or break what's going on for that individual resident in their space in that time.
So I'm curious. When you guys at Plated were looking at all these problems, what made you think we can actually solve this when there were so many others that have tried, but they've also failed, Ms. Carolyn?
Every problem can be solved.
Okay.
I firmly believe in that.
I like that.
That's a big part of my worldview. Every problem can be solved. If it hasn't been solved yet, we probably just need new insight, new light shed on it. We need to bring something else to the table to help solve the problem. We felt like this problem was really worth solving. It was worth putting the time, the effort, the energy into figuring out how do we safeguard healthcare food service operations for the next wave, the next kind of generation. So rather than just trying to muscle through the old way, we really wanted to take a step back and look at how are we going to do this in 10, 15, 20 years if the labor problem's not solved, if the financial problem's not solved, if the operations don't become magically easier to manage. And so in taking that step back and looking kind of broader, more holistically at healthcare food service operations, it was really, I don't want to say it was obvious, but it was clear. It was clear to us that we could bring something new to the market that could really help make it easier to operate, safer to operate, and deliver just as good of a product, if not a better product, at the end of the day.
Okay. Good answer. Good answer. I also saw this, Miss Carolyn. So go ahead, tell me if this is true. I saw that you had partnered with OHI. I didn't know who they were at first, I have to admit. But then I saw they're one of the biggest healthcare REITs in the country. How did you gain that acquisition?
Yeah, this is a great story.
Okay.
And we're thrilled to have them as our primary investor. They've done our seed and our first round of funding, so they've been fantastic partners to work with. OHI, Omega Healthcare Investors, is, you're correct, one of the largest healthcare REITs in the country. And what's really cool about OHI, which I didn't learn until we started to talk with them and get involved with them, is that they take a very different approach as a REIT. They're not just about the building and the tenant in the building, but they're really about supporting the business and helping the business that's operating in the building thrive. And so what's really cool about them is that they have a very specific investment portfolio in that they look to companies that improve the operations and the lives of the people who are in the day-to-day at these healthcare facilities. And so that's not just the resident. The resident's life is always worth improving, but they also want to improve the employees' lives because they know that the happier the employees are, the better the operations running, the happier the residents are. So we came about, you asked, sorry, I derailed from your initial question. You asked how we got involved with OHI. OHI initially came to the company that I was working for prior, that one of our founders, Rich Valway, founded and runs. And they came to Rich initially and said, this is the problem we want to solve. We surveyed our operators and asked them, if we could solve one thing in your day, what would be the most impactful thing? What would give you back the most time, the most brain energy, resources, all this stuff? What could we solve for you? And the unanimous answer, the most popular answer, was food service. And so I think they anticipated a really complex answer, like solve this financial management thing or solve this clinical outcome or something. But the majority answer was food service. And so from the outside looking in, OHI is not a food service operation, right? They're a healthcare REIT. They thought, okay, this is an easy problem to solve. We can do that, no problem. Let's go find some contract managers and ask them, how do we solve this? And we'll figure it out. Okay. So they came to the contract management firm that I was working for and asked for help in solving this problem. And it just so happened that Rich and I were already working on answering pretty much the same question. And so it was no surprise to us when they said our operators want food service solved. We said, yeah, we know, because it can be really problematic. When it goes bad really fast. And it's really hard to correct. And it costs a lot of money to fix it. We said, we think we have a solution for you, but to do it right, we've got to do it big. And we're going to need help. And they showed up at the table to help.
So what did you actually do?
Yeah. So what we actually built is this incredible solution. And I'm not trying to skirt your question, I promise. I could talk about this all day if you let me. I will nerd out on it. But essentially what we've built is a food product that shows up ready to go. We've got a heating system that takes that food, heats it, maintains the quality, and we've got software that kind of wraps the whole system together that makes it easy to operate in these food service environments. And even though I love to talk about it and I'll talk your ear off, my team is just as passionate as me, and I'm sure they would like to tell you about it too.
All right. I'll be here. Miss Carolyn, it's been really nice talking to you. But before we get too deep, we have other episodes to dive into, other segments as well. We're talking food, labor, technology. I hope you stick around for those episodes as well. Good talking to you.
Same.